Hi guys, and welcome back to my channel. For those that are new here, my name is Nadine. I'm a registered midwife here working in the UK. So in today's video, I'll be talking about the risks and benefits for either having a cesarean section or having a vaginal delivery birth. So we'll be talking about all of that in great detail in today's video, and my aim is to give you guys as much information as I can to help you guys make an informed decision on what route to take, whether it's a cesarean section or having a vaginal delivery. So these videos are for educational purposes. I still do recommend, highly recommend, that you still go and speak to your midwife and your doctor so that they can make a tailored care plan for you, as they know your risks and your benefits for either having a cesarean section or a vaginal delivery. So still go to your doctor and your midwife and have these discussions with them. But this video will also help you gain as much information as you possibly can, so you can have the right questions to ask your midwife and your doctor when you next see them at your next appointment. So the aim of this video is not to advocate for either a cesarean section or a vaginal delivery. It's just to basically inform you about the risks and benefits for both. But just keep in mind that every pregnancy is different, every situation is different, so speak to your midwife and your doctor to what is best for you and your baby. So solely for this video, I'll be talking about elective cesarean sections. So these are sections that are planned, that you have chosen to go for, rather than speaking about emergency cesarean sections. So elective cesarean sections, you have decided to go for a section, it's planned, it's scheduled, and you know that's the way you want to deliver your baby. And for vaginal delivery, I'll be talking about pushing your baby out through the vagina and the risk and benefits for that. So I'll be talking about elective cesarean section and vaginal delivery. And elective sections mean you have chosen to go for a cesarean section rather than having an emergency section. So some cesarean sections can either be planned or recommended by your doctor due to the level of risk for yourself and for your baby. So on the screen here, I've listed a few risks that your doctor can take into consideration when recommending or suggesting that you should have a cesarean section. So please be aware that there's some situation where the doctor can recommend that you have a planned cesarean section over a vaginal delivery. However, a lot of women don't actually know this, but you can actually opt in for a cesarean section by choice with no risk factors involved. So you can have a low risk pregnancy and decide to still have a cesarean section, which we call having an elective cesarean section here in the UK. So you basically can have the option to have a vaginal delivery or a cesarean section if there's no other risk involved to yourself and your baby. So let's talk about the pros for having a vaginal delivery. So the first pro for having a vaginal delivery is that it's deemed as the safest option for you and baby according to the doctors. If you have a low risk pregnancy and there's no risk for you or your baby, then having a vaginal delivery is deemed as the safest option for you and your baby. So you don't have to worry about having major surgery and all the risks involved having major surgery. So it's deemed as the safest option for you and your baby with no risks involved. So the next pro for having a vaginal delivery is that your recovery time after birth is a lot shorter compared to having a cesarean section. So after you push the baby out, your recovery time is a lot shorter and you basically recover a lot quicker than someone that's gone through major surgery. So you basically recover a lot quicker after having a vaginal delivery. You're able to walk around, move around a lot easier than someone that has undergone major surgery. So that is one pro for having a vaginal delivery. The recovery time is a lot quicker and a lot easier for mums who decide to have a vaginal delivery. So the next pro for having a vaginal delivery is that your hospital stay is a lot shorter. So the amount of time you stay in hospital after delivering your baby is a lot shorter. So if you've had no complications with your birth, you basically can leave the same day or the next day after having your baby. So the expected time for mothers who have a vaginal delivery in the hospital is a lot shorter compared to those that have a cesarean section. So that is one big advantage for those that have a vaginal delivery, but it also depends on the person. Some people would rather stay in hospital for a lot longer until they've recovered properly, and some people just want to get out of the hospital and go home as soon as possible after having their baby. So that is one advantage for having a vaginal delivery, is that your hospital time is a lot shorter after delivering your baby if there was no complications involved in your delivery. So the next pro for having a vaginal delivery is that you get to have baby on your skin, so have skin to skin contact straight away after your vaginal delivery. So this offers you time to bond with your baby and have that first skin to skin with your baby for a long period of time. After delivering your baby, you get to have skin to skin contact and bond with your baby straight away for a long period of time after having a vaginal delivery. So as a midwife, what we tend to do in the hospital after a woman has had a vaginal delivery, what we do is that we recommend that mum and baby have that first initial skin to skin contact. So we place baby on mum's chest and they can have that first initial skin to skin contact, and also mum can initiate breastfeeding and start breastfeeding baby straight away. So that's two big advantages of having a vaginal delivery, is that initial skin to skin contact that you can have for a long period of time, and you can also start breastfeeding after your vaginal delivery if there's no complications whatsoever for yourself and for baby. So another benefit for having a vaginal delivery is that the muscles involved in pushing baby out, and also the contractions involved in pushing baby out, also squeezes the fluids out of baby's lungs as baby passes through the birth canal. So it squeezes all the fluid that was in baby's lungs as baby is born and squeezed out of the birth canal, which is so beneficial to baby and once baby is born. So that is one big advantage of having a vaginal delivery, is that the muscles involved in the contraction basically squeezes out all the fluids that were in baby's lung, which then helps baby out in the long run. So that is one big advantage of having a vaginal delivery. So another benefit for having a vaginal delivery is that if you're someone that wants to have a large family and want to have a lot of children, then having a vaginal delivery is less complicated for you. So the less complicated your birth is, the more children that you can have, and having a vaginal delivery allows you to have more children and expand on your family, because you have had a less complicated birth compared to having a cesarean section. So mothers who have vaginal delivery can expand on their family and have a big family because they have had a less complicated delivery. And another benefit for having a vaginal delivery is that mothers don't have the associated risk compared to someone that's had a cesarean section. So there's a less risk of you developing an infection or bleeding excessively after a vaginal delivery. So all the risks that are associated with major surgery or having surgery, such as infection, blood clots, or bleeding excessively after delivery, is very minimal with someone that's had a vaginal delivery. So that is one benefit for having a vaginal delivery, is that you don't have the risks involved in surgery, such as infection or bleeding or having a blood clot or other risks that are associated with having surgery. So that is one big benefit of having a vaginal delivery. So another benefit for having a vaginal delivery is that if your vaginal delivery was not complicated, nothing went wrong, and it was pretty straightforward, then you don't have any long-lasting pain. So after a non-complicated vaginal delivery, you are not expected to have long-lasting pain. So you can basically go home straight away, mobilize straight away, and basically go about your usual day-to-day tasks. So there's no long-lasting pain after having a non-complicated vaginal delivery birth. So let's move on to the disadvantages or the risks associated with having a vaginal delivery. So the first risk associated with having a vaginal delivery is that there's a likelihood or there's a possibility for having an instrumental delivery. And what I mean by an instrumental delivery is that delivering baby via forceps or suction. So in an emergency situation where baby is not coming out quick enough, or there's certain situation where baby is too high, then the doctors may recommend that you have an instrumental delivery, so assisting you to push baby out by either applying forceps or applying a suction cup. So this is another risk associated with having a vaginal delivery, is the likelihood or the possibility of you needing to be assisted by having either forceps delivery or suction in order to get baby out. So another risk associated with having a vaginal delivery is the pain. So you know you're going to be contracting, you're going to be in labor, so you're going to feel the pain compared to if you have a planned cesarean section. So you're going to feel the pain through the contractions and through pushing. You're going to feel all the pain if you have a vaginal delivery. So that is one risk involved in that. So if you're someone that doesn't have a high pain threshold, or you don't want to experience the pain that comes with having a vaginal delivery, then you can consider having a cesarean section, because having a vaginal delivery also comes with the pain of labor and actually pushing baby out. So another risk associated with having a vaginal delivery is the risk of tearing. So tearing the vagina, the perineum, the skin between the vagina and the anus, tearing as you push the baby out. So we have things called the 1st degree, 2nd degree and 3rd degree tear. So that is the risk of having a vaginal delivery, is the possibility of you tearing while you push baby out. So if you're someone that doesn't want to have stitches down below in the vagina, then a cesarean section will be for you. But also with a cesarean section, you will also be stitched up in the scar area where they need to pull baby out. But having a vaginal delivery, there's a possibility of you tearing. Not everybody tears. There's some women that have their first baby and don't tear. There's some people that have their first baby and still tear. So there's a chance to either tear or not tear, but that is the risk that you take if you choose to have a vaginal delivery, is the likelihood of you tearing. So another risk associated with vaginal delivery, which basically ties into my previous point, so the stretching and tearing of the pelvic floor muscle as the baby gets pushed out of the vagina. It can tear and it can cause injury to the pelvic floor muscle, and the pelvic floor muscle basically controls your urine and bowel function. So what this means is that you can lose control of your urine or your bowel function because of the injury associated to the pelvic floor after pushing your baby out. Obviously, some people cannot experience any long-term or long-lasting pain or injury to the pelvic muscle, which then affects their control of their urine and bowel function. So this is just a risk that can happen for having a vaginal delivery, is that from the stretching and from the tears, it can cause injury to the pelvic floor muscle after having a vaginal delivery. Another disadvantage for having a vaginal delivery is that there's a possibility of something going wrong and having to end up having an emergency cesarean section. So there's a likelihood of baby not being happy and something affecting baby, making the baby's heartbeat drop, or something going wrong with mum and ending in you having an emergency cesarean section, which can be more traumatic to you because it's not prepared, it wasn't in your birth plan. So there's a likelihood of you having an emergency cesarean section after contracting for so many hours or laboring for so many hours and ending up having an emergency cesarean section, which can impact your birth experience and make your experience more traumatic than you would like. So that is another risk associated to having a natural delivery, is that something can go wrong after laboring for so many hours and you can end up with having an emergency cesarean section. So let's move on to the pros for having a cesarean section or a planned cesarean section. So the first pro for having a planned cesarean section is that you basically know what's going on and it's typically straightforward. So you have your scheduled cesarean section, you know what date baby is going to be born. Obviously you won't know the time baby is born, but you know the date baby will be born, so you have time to plan around that. So if you need to tell any family members that are flying in to see you can tell them that baby will be born on this date so they can be around to see you after baby is born. So having the cesarean section allows you to be in control. You know when baby will be delivered, therefore you are better prepared for when baby arrives. Whereas if you have a vaginal delivery, it's basically out of your control. You don't know when baby will be born. Whereas if you have a planned cesarean section, you basically walk in the date they tell you and you know when baby will be born. So the next advantage for having a cesarean section is that it's pretty straightforward. After your cesarean section has been planned and booked and scheduled, you basically go into the hospital, you're not contracting, you're not in pain, and you basically go into the theatre and they do everything that they need to do in terms of giving you the medication. And once they start the cesarean section, it doesn't even take that long, roughly 15 to 20 minutes to get baby out, then an extra 45 minutes or an hour to basically stitch everything up, depending on any other complications that may arise. But having a cesarean section or a planned cesarean section is basically straightforward. You basically walk into the hospital very calm, very relaxed, with no pain, you're not laboring, and everything is basically straightforward, and baby is basically delivered in 15 to 20 minutes, and they basically have to then stitch you up, which takes a little longer, but everything else is basically straightforward. So that is a pro for having a cesarean section, is basically straightforward. You walk in there and you walk out. So another pro for having a cesarean section is that you are not experiencing the laboring pain or being in labor. So you're not going to have the contraction pains, you're not going to be in any pain. You're basically going to go walk into the theatre with no pain, and they're basically going to give you the anesthesia to basically numb you from here down, so you're not going to be able to feel a thing and you're not going to be able to experience the labor pain. So if there's something that you're trying to avoid that comes with having a vaginal delivery, then having a cesarean section will be better for you, because having a cesarean section allows you to be pain-free during the whole procedure. The pain only comes after you've had your baby when you're recovering, but during the whole cesarean section phase you are basically in no pain because they give you the anesthesia while you're having the surgery, and you don't have to experience the contraction and the labor pain. So another benefit of having a C-section is that there's no risk of you tearing in the vagina or down below. So having a C-section, they're basically cutting you open from the abdomen, so there's no likelihood of you having a tear in the vagina. So that's one benefit of having a cesarean section, is that the risk of you tearing and going into the trauma of tearing and needing stitches in the vagina, the risk is taken away from you because you're having a cesarean section. So there's no trauma to the pelvic floor muscle or the pelvic floor because you're not having to push the baby out. So that is one major benefit of having a cesarean section, is that you'd have no risk of actually tearing in the vagina. So another benefit of having a planned cesarean section that basically ties in with the previous point, there's no likelihood of you having urinary incontinence. So basically you'll be able to still control your urine and your bowel function because your pelvic floor is still intact. There's no stretching or injury to your pelvic floor. So that is one major advantage for having a planned cesarean section, is that there is no damage to your pelvic floor muscle after you deliver your baby. So let's move on to the risks or the cons for having a cesarean section. So the first risk or the first con for having a cesarean section is that your recovery time is typically longer than those that have had a vaginal delivery that wasn't complicated. So your recovery time is a lot longer, so you will probably stay in the hospital a lot longer compared to someone that's had a vaginal delivery. So having a cesarean section basically means that you will stay in hospital a lot longer to recover compared to someone that's had a vaginal delivery birth. So the next risk of having a cesarean section is that because it's major surgery, there's a likelihood of you developing an infection or having excessive bleeding or having other complication during your cesarean sections. So other complications could be that there could be damage to other organs surrounding your uterus or tubes. So the other con or the other risk of having a cesarean section is because it's considered as major surgery, there's a likelihood or a higher chance of you developing an infection, having excessive bleeding, or developing a blood clot or having other complications. Other complications could include either damage to other surrounding organs that are surrounding the uterus, or having damage to the uterus or the tube because it's considered as major surgery. So another con for having a cesarean section, so this differs to the person if you care about this or not, is that you will have a cesarean scar. So the scar can be very tiny and you can be very, very small to the eye. After some time, some people don't even notice their scar, it kind of disappears, or it's very, very small and you basically have to point it out to people. And some people it's very visible and it's very there. So it depends on who you are. If you're someone that doesn't care about the scar, then this won't be a con for you. But if you're someone that cares about having a permanent scar, then this is a con for you. So having a cesarean section means is that you will have a permanent scar. So another con for having a cesarean section is that if you're someone that wants a big family or a large family, then you are limited because you've had a cesarean section or you've had multiple cesarean section. So in the UK, they don't recommend you to have more than 3 cesarean section. 4 is kind of pushing it, but they don't really recommend you to have more than 3 cesarean section. So if you don't want a big family, then by all means have the cesarean section. But if you're someone that wants a large family and you want loads of children, then having multiple cesarean section is a risk to your health. So doctors won't recommend that you have multiple cesarean section if you intend to have like a big family or a large family. So having cesarean section basically makes you high risk, and therefore all your other pregnancies will be high risk, and you will basically have to be monitored throughout your pregnancy and birth because you've had a cesarean section before. So that is one con or one risk for having a cesarean section, is that if you plan to have a big family or a large family, then this is a disadvantage to you. So another disadvantage for having a cesarean section is that some hospitals, not all, but some hospitals don't allow skin-to-skin contact with mum and baby straight after the cesarean section. So they do allow you to see baby, but because of all the drapes and all the surgical equipment that will be on mum, the opportunity to have skin-to-skin contact with mum is very, very minimal. Some hospitals allow this. They actually go out of their way to make sure that mum has the skin-to-skin contact with baby while they're closing up the incision site oversight and making sure that mum is okay, they actually allow this to happen, but some hospitals don't allow skin to skin contact. So what I would recommend for anyone having a cesarean section that would like skin to skin contact with baby, I would recommend that you allow your birthing partner, your husband, your wife to do that for you, so they can have skin to skin with the baby while they are basically closing up the incision site for you. But that is one disadvantage for having a cesarean section, is that some hospitals don't allow skin to skin contact with baby. So my last and final point is that some research has suggested that because some mums have had a cesarean section, that breastfeeding is a lot harder or unsuccessful to mothers who have a planned cesarean section. But this is not true. There's some women that either have a vaginal delivery or a cesarean section and still struggle with breastfeeding, and there's some women that have a vaginal delivery and still struggle with breastfeeding, and some women that have a planned cesarean section or cesarean section and basically breastfeed fine. So breastfeeding is subject to the person and the situation and what happens. You can still breastfeed your child after having a cesarean section and you can still struggle, so it can go either way. It doesn't mean because you've had a cesarean section that you will struggle to breastfeed. It doesn't mean that at all, because I've seen so many women that have had a cesarean section and they have breastfed their babies beautifully with no struggle. But I've also seen it happen the other way. I don't think the cesarean section has any effect on breastfeeding and how mums breastfeeding, whether it's successful or not. So that is my last and final point for this video. If you would like more information surrounding cesarean section and vaginal delivery, I've put some links in the description box below for you guys to read on. If you guys would like statistics or more information surrounding what to do, whether to have a cesarean section or to have a vaginal delivery. But like I said guys, this is for educational purposes. Please do go and speak to your midwife and your doctors. Depending on your situation, they will weigh the risks and the benefits for you to either have a vaginal delivery or have a cesarean section. So I hope this video was helpful for you guys and you guys have gained as much information as you possibly can when deciding if cesarean section is for you or a vaginal delivery is for you. But that is it for today's video. I hope you guys have enjoyed it. Please hit the subscribe button if you haven't hit the subscribe button before, and also hit the thumbs up button if you guys have enjoyed today's video, and I'll definitely see you guys in my next video, which will hopefully be soon. So until then guys, bye for now.